I want to talk about some key aspects in vascular disorders. That's blood vessel disorders. Of course, blood vessel disorders are usually characterized by bleeding or blood clots. So, okay, this one is the bleeding aspect now, you understand? So, what are the various ways in which you can actually bleed if you have a blood vessel disorder? So, they're different. It's just simple. Right? So, most of the times, those bleeding, you bleed into tissues, right? So, you bleed into tissues. So, these bleedings, they have different patterns. So, there are names attached to each of the patterns which we'll be looking at here. So bleeding patterns in vascular disorders, they vary, and this is depending on the underlying condition affecting the blood vessels. So these disorders, they typically lead to what? Mucosal bleeding, skin manifestation, you easily bruise up, rather than deep tissue or joint bleeding seen in coagulation disorders. So what are the common bleeding patterns in vascular disorders? You have petechiae. Where is petechiae? This is petechiae here. They are tiny pinpoint red or purple spots caused by capillary bleeding. It is petechiae. Alright. So petechiae can also be large patches. Okay, no. This is purpura. Alright. I think they're supposed to. I did a typo. It's supposed to be purpura. It's supposed to be purpura. After petechiae, it is larger, it's purpura. So tiny bleeding under the skin, often seen in conditions like the Henoch-Schönlein purpura and the Ehlers-Danlos. Then you have the Ecchymoses. Ecchymoses here. You have Ecchymoses here. This is it. So in Ecchymoses, we said that bruises that develop due to what? Fragile blood vessels. Okay. Common in senile purpura and connective tissue disorders. They have the nosebleeds. That's what? Epistaxis. So there's frequent what? Okay, it's frequent in hereditary hemorrhagic telangiectasia, where abnormal blood vessels formation leads to what? Recurrent bleeding. Gastrointestinal bleeding. It's seen in vascular disorders affecting internal organs like the pseudoxanthoma elasticum. So these are the different patterns of bleeding you see in blood vessel disorders. It's just very simple. So this is another picture. It's very clear, right? So causes and risk factors, sometimes in inherited disorders like Marfan syndrome, Ehlers-Danlos, acquired disorders like scurvy, steroid purpura, vasculitis can lead to this. Sometimes it's aging, where blood vessels become fragile over time, all of that. So still have it here. Ecchymoses, purpura, epistaxis, petechiae.